Honorable Chairperson, Chief Guest, respected teachers, and my dear colleagues, Assalamu alaikum. Welcome to the today's scientific session. We are so glad you could join us today. My name is Dr. Mehdi Hassan, Registered Department of Cardiology, CBMCB, and I will be your moderator for this session. Over the course of this conference, we will be exploring cardiovascular diseases with insight from some of the most knowledgeable and passionate experts in the field. Our goal today is to create a space for learning, meaningful discussion, and connection. I encourage all of you to actively engage, where it's through asking questions, sharing your perspectives during discussion with your fellow attendees. We have a fantastic lineup of speakers and panelists who will be sharing their expertise and experiences. Without further ado, let's get started. Now I request our chairperson, Professor Dr. M. Karim Khan sir, to conduct the rest of the session. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum and very good morning. Honorable Chief Guest, special guests, panel of experts and speakers. Nevertheless, distinguished teachers, dear colleagues, ladies and gentlemen. Today, we are really fortunate enough that people have already been arrived here, and some of our guest speakers, they have come from Medicine Medical College to share their knowledge with us. We are really happy to see them among ourselves. Ladies and gentlemen, as there is time constraint, we will not go any more discussions right now. But as you all know that non-infectious disease like the cardiovascular diseases, malignancy, diabetes mellitus, hypertension, all these are now very important, and they are responsible for most of the ailments in our country. And it is also the same scenario in our neighboring countries as well. Ladies and gentlemen, without any further delay, I will request our today's first speaker, Dr. Tofayel Uddin Ahmed. He will present one original research article done by himself, clinical characteristics of acute heart failure patients admitted to community-based medical college hospital, Bangladesh. Now I am requesting Dr. Tofayel Uddin Ahmed, Associate Professor and Head, Department of Cardiology, CBMCB, to come up to the dais and to present his presentation, please.
Bismillahirrahmanirrahim. Respected Chairperson, Honorable Chief Guest, distinguished special guest, esteemed panel of experts, my dear senior and junior colleagues, Assalamu alaikum. I am Dr. Tofayel Uddin Ahmed, Head of the Cardiology Department. I am truly honored to welcome you all today. A big thanks and gratitude to our college authorities for supporting us to hold the scientific program. Renowned faculties from NICBD, Mymensingh Medical College, have honored us by participating in the seminar. We express our gratitude to them from the depth of our heart. This is not just a seminar, it's a chance to share ideas, learn together, and inspire each other. This is our third year organizing this event with your support and enthusiasm. We hope it make it even bigger in the future. I believe today's discussion will boost our knowledge, improve our work as a doctor. Dear audience, now with the chairperson's permission, I would like to present my case. My topic is clinical characteristics of acute heart failure patient admitted to community-based medical college hospital, Bangladesh. This article already published in Asian Journal of Cardiology Research, Volume 8, Issue number 1, 2025, page number 337 and 343. All the data of this article are collected from the cardiology world. With me, co-author Dr. Emdadul Haq, Parvez Rahman Khan, Mehdi Hassan and Shaila Shadar helped me to collect the data. Original article received in 27/3/25, except 29/5/25 and published in 26/25. Background. Heart failure remains a growing public health challenge in Bangladesh, yet comprehensive data from community-based hospitals are lacking. Understanding local clinical pattern is crucial for improving management and strategies. Objective. This study aims to characterize the clinical presentation of acute heart failure patient. Methodology. A prospective cross-sectional study was conducted at the community-based medical college hospital from January 2023 to December 2024. We enrolled 113 consecutive acute heart failure patients through purposive sampling. Data collection include detailed history, physical examination, echocardiographic evaluation. Analysis was performed using MS Office tools. Introduction. Heart failure is becoming the major global health concern. The burden is especially high in low and middle income countries like Bangladesh. Although we have international guidelines for diagnosis and treatment, we know that the situation is not always same everywhere. Difference in the case disease, associated medical condition, and even access to healthcare mean that local data is very important. Most of the existing research in Bangladesh has come from the large urban areas, but this may not truly reflect what is happening in the smaller community hospital. Most people actually sick here. That is why our study was designed. We look closely at the clinical profile of heart failure patient in the community-based medical hospital in Mymensingh. We believe that our finding will help clinicians in similar setting to better recognize how heart failure present, make earlier diagnose, and ultimately improve patient care. Result. Patient demography and clinical profile. Mean is 64.4 plus minus 11 and male is 75% and reduced ejection fraction less than 40 is more than 8.1 and preserved ejection fraction more than 40 is 18. Etiology of the heart failure. Etiology: ischemic heart disease 51% and more, hypertensive heart disease 60 more, and dilated cardiomyopathy 19 and more, and valvular heart disease 13 and more, and postpartum cardiomyopathy 4 and 4.4. Result. Symptoms of the presentation: shortness of breath 96.5, orthopnea 86.7, paroxysmal nocturnal dyspnea 77, and bilateral basal preposition 92.9, leg edema 3.2, and raised JBP 59.3. Comorbidities: diabetes mellitus 72 point and more, hypertension 60 and more, and dyslipidemia 66 and more, and atrial fibrillation 43 and more, and chronic ischemic heart disease 46 and more, and valvular heart disease 13 and more. Additional finding: thyroid dysfunction 20 and more, and hypothyroidism 12, and hyperthyroidism 8%. Hemodynamic profile: systolic blood pressure less than 116, 70.8, diastolic blood pressure less than 75, 84.1, and tachycardia 69.9. Discussion. This prospective study on acute heart failure in Bangladesh Community Hospital reveals key clinical patterns compared to the regional and global data. This cohort's age and male predominance align with South Asian studies but differ from the Western population with older presentation. This high prevalence of reduced ejection fraction exceeds international registries suggests advanced disease presentation. Symptoms like dyspnea, orthopnea, crepitation, and more frequent than in global studies indicate severe presentation. High rate of diabetes, hypertension, suppress global average and align with local data. Ischemic cardiomyopathy, hypertensive heart disease dominate etiology and contrasting with high-income countries where non-ischemic causes prevail. These findings highlight the regional difference in risk factor, disease severity, pathophysiology, and understanding the need for tailored prevention and treatment strategies. Limitation. This study has several limitations, including it's a single-centered design which may affect the generalizability, and use of purpose sampling which could introduce selection bias. Additionally, the lack of long-term follow-up data and advanced biomarker limits our ability to assess prognostic outcome and more nuanced pathological insight. Conclusion. Our study reveals that heart failure patients in Bangladesh Community Hospital predominantly present with reduced ejection fraction, severe congestive symptom, and high cardiometabolic comorbidities. These findings underscore the urgent need for improved prevention and management strategies targeting ischemic and hypertensive heart disease in resource-limited setting, where late presentation and complex risk factor burden challenge optimal care delivery. Our recommendation: to improve heart failure outcome, we recommend community screening for early detection, primary prevention of metabolic risk factor, tailored management of protocol for limited resource, patient education on symptoms recognition, and research on context-specific treatment. Disclaimer: no generative AI technology such as large language model, text-to-image generation have been used during the writing editing of this manuscript. Thank you. Thank you for patient sharing. Assalamu alaikum.